Hello, and welcome to Let's Talk, a series of podcasts produced by the Hazelden Betty Ford Foundation on the issues that matter to us and the issues that we know matter to you as well. Substance use disorder, prevention, research, treatment, and recovery support. I'm your host, William Moyers, and today we're on the road here at the Betty Ford Center in Rancho Mirage, California, where we're joined by Chris Yadrid. Chris is the Vice President of the West Region. You are the administrator of the Betty Ford Center. Welcome, Chris.
Thank you very much. I'm glad to be here.
Glad you're with us today to talk about an issue that I know that you and I and many others in our organization get all the time, the issue of finding the right treatment program. How do people go about finding the right treatment program for a substance use disorder?
Right. Well, I think how they actually go about it is they often do a web search. And then when they do so, there are over 14,000 different treatment centers in the United States. And so it can be very difficult to choose. So I think there's some important things to take a look at or factors to consider when one is seeking treatment for themselves or for a loved one. Is it a licensed facility? Do they practice by ethical standards? And do they offer a complete continuum of care that meets people at their most critical moments, physically, psychologically, in the throes of addiction, but then supports them and offers support in a long-lasting way?
So we know that a drug is a drug is a drug, but we know that drugs interact differently, but a treatment program is not a treatment program is not a treatment program, right? You need to find a program that matches the needs of your loved one or yourself.
Absolutely. Every person has unique and individualized needs. You're right, a drug is a drug. And yet we all experience the chaos and the effects of addiction in a slightly different way, perhaps depending on our age or our community, the number of resources we have available to us in terms of support within that community. So I think it's very important to research treatment centers thoroughly and effectively. Probably most important is to take that first step and reach out for help. That's one of the hardest things people face, is actually making that first call. A few years back, the Surgeon General released a report, and the report said that maybe 1 or 2 out of 10 people in this country who need treatment get treatment. So one of the toughest things is for people to access treatment in the first place. So I'm glad we're talking about this today.
But people put into a Google or another search engine rehab or drug addiction treatment facility and so on, and they may get a lot of information, but you just can't go off of that information. You need to make that phone call, right?
You need to make the phone call. I would call a trusted resource, whether it's the Hazelden Betty Ford Foundation or anyone else who's accredited and licensed appropriately. I think more and more, and again, as a foundation, we offer training for medical students or professionals, medical professionals and residents, on how to assess and intervene upon individuals struggling with addiction. So one's primary care physician is oftentimes a resource. There are a number of different reputable resources or ways to access treatment. Certainly, I believe in the work that we do here at Hazelden Betty Ford, because it offers that complete continuum of support for individuals seeking recovery.
But of course, we also know that so many people now are accessing treatment through their insurance. So it's not just a question of finding the place you want to go to. You have to find a facility that's not only medically or clinically appropriate for you or your loved one. You have to find one that is recognized by your insurance company. Can you describe that process?
Yeah, absolutely. A person is going to want to seek treatment where the costs of treatment are transparent. I also think that's an ethical issue that's important. At the Hazelden Betty Ford Foundation, it's been our goal to serve more and more people. As the problem of addiction continues to grow in this country, we want to provide better access to individuals. And so over the last 5 years or so, we've really transformed our model where we're serving individuals primarily, over 90% of the time, who are accessing their insurance benefits. So contacting your insurance carrier is another way to sort out what's involved with that process. If you were to call the Hazelden Betty Ford Foundation, the first person that you would speak to here in our access department would help you work through some of those questions related both to finances, but also whether or not you're appropriate for care here at the Hazelden Betty Ford Foundation.
Right. And in fact, we know there are many pathways to recovery, more so perhaps than at any other time in our history, which means there are many pathways to a treatment center. There are many different types of treatment centers. What are some of the different ways that people can get treatment?
So when you talk about different pathways, I think of some individuals who simply engage the 12-step community, which has been present for 80 plus years and helped countless individuals find recovery. But sometimes, especially with the potency of drugs today, even beyond, certainly beyond alcohol, and alcohol is probably still one of the major substances of use that people come for treatment for. But given the potency of many substances today, people need extra help. They need extra support beyond that. And so that's a good reason to access a viable and a qualified treatment center.
There are many people who are turned off by the 12 steps. I mean, that's been hanging on the wall of all of our facilities for 70 years now, and that's a pathway that's worked for many millions of people. But there are people who say that that's probably not for them because it's either a religious program or it's too spiritual for them. What would be your counsel to people who are sort of turned off by the 12 steps?
Well, again, that's a great question. I think a number of people present at times with barriers to accessing 12-step communities or 12-step support. If it were to be characterized as a religion, I'd say that is a real problem, because if it's regarded as a religion or treated as such, that's contrary to the values of the program and probably very unhelpful to the process of recovery. I might describe it as a program for spiritual transformation. That's probably a more helpful way and a more inclusive way to think about the 12 steps. And I also think it's one part or one aspect of the experience. Today we use medication-assisted treatment.
Yes.
We use other evidence-based therapies such as motivational interviewing or dialectical behavioral therapy, a whole variety of modalities that are evidence-based, research-based to help people recover in addition to the 12 steps. It's a disease, it's a chronic disease that impacts a person's mind and their body and their relationships and their spirituality as a person. So we need to use all the resources possible to help people heal.
I oftentimes remind people who contact me asking for guidance on how to access treatment with us or somewhere else. I often remind them that treatment is not the end, it's just the beginning of a process, and that there is no cure for addiction, at least not in the way most people expect, but there is a solution. And so it is really about disease management, right? Chronic disease.
It really is. For years in this country, we've treated a chronic problem as an acute issue.
Yes.
In my own experience, when I first got into this field of mental health in general, but then addiction specifically, I used to work in a hospital emergency room on the south side of Chicago. And I was a crisis counselor there. And I would see people with psychiatric complaints, but in particular substance use disorders, enter the emergency room and then be pushed off to the side and just placed on a cot or a gurney in the hallway until they could sober up and then be pushed back out to the street. And the staff would refer to these individuals as frequent flyers because they'd come in and out. It was a revolving door in which people really didn't get the help that they need. And so we absolutely need to treat this as a chronic problem and address not just the body, but the mind and the spirit, and allow someone or give someone the best opportunity for lasting recovery by providing resources to extend that over time. Recovery doesn't just happen in a single moment or in a single day, but over weeks and months and years of restoring the body, building relationships, moving out of isolation into community and relationship with one another, developing a spiritual program that's not religious in nature per se by any means, but impacts the human spirit in terms of how we create meaning and purpose as human beings in our lives.
I often talk about the fact that it's easy to stop using, it's hard to stay stopped, and stay stopped is about getting those tools in treatment, but then learning how to use those tools in the real world. So really, when somebody is accessing treatment, they should expect that they're going to get more than just a way to stop using, but how to stay stopped.
I think that's a great point. And if I were calling for myself or for a loved one, I would ask what resources exist beyond the initial stages of treatment. Are there web-based programs of support? Are there recovery coaches that I can stay connected to over time? How do you help me get reconnected back into my community or develop other resources once I return? What are your attitudes or beliefs about the use of medication-assisted therapy or treatments in order to provide a floor or a resource to individuals who are trying to put together the psychosocial aspects of long-term abstinence and sobriety? There are a lot of great questions that can be asked at the beginning of the process to make sure that you or your loved one get the care that they need.
And what about community-based treatment? We know that, oftentimes many of our patients will travel to come to treatment here at the Betty Ford Center or in Minnesota or Oregon, where else we have facilities. But not everybody can get on an airplane or travel to treatment. Talk about the role of community-based treatment in this country.
Sure, I think that's an important issue. And the reason why I believe it's important is because addiction impacts every part of our lives. It's not just our bodies. It's our relationships, it's our minds, right, as we've been saying. So if I'm going to get well, or if I'm going to stop using, as you just described, but to be able to stay stopped or sustain that recovery, I need to figure out how to reintegrate into my community, working or get back to work, live with my family, develop those community resources. So whether that's a 12-step community or whether that's online and internet-based support so that I can get the tools that I need and the knowledge that I need, it's really important to build resources. And I would just say it's especially important to build resources in terms of one's community. One of the things that we promote as well as we help people move toward the process of discharge from those early stages of treatment is to help them connect with a primary medical care provider or a counselor in their community of origin, a therapist, 12-step community or other support group resources, similar but perhaps even different than 12 steps, to help them build those relationships that are so vital to their long-term recovery.
And of course, a lot of people who are looking at treatment options want to know, does it work? So what's the role of outcomes in that consideration and the transparency of outcomes?
I also think it's important to be asking about outcomes. Many people have this perception that addiction and addiction treatment centers are simply revolving doors, like the emergency room that I described earlier in our conversation. I'm really proud of the work that we do here. As we treat patients, we ask for their permission to follow them and contact them, to follow them in terms of outreach so that we can learn more about our outcomes. We call patients at 1 and 3 and 6 and 9-month intervals and beyond. At 9 months, we've found that about 70% of our patients have been free, have practiced continuous sobriety from using alcohol. What we find at the 9-month mark is that 80% of our patients report a very high quality of life and quality of health. And we use survey questions from the World Health Organization survey that's very, very well thought of. About 90% of our patients at that 9-month mark report to be free of all other drugs separate from alcohol. And I'm proud of those statistics because this is a tough disease. I mean, it's a chronic illness. There's tremendous stigma attached to it. The people who face this disease are incredibly courageous. They're the most courageous people I know. And it's tough work to get well. And the vast majority of our patients who engage treatment do get well.
And what's your message to those who might have relapsed? They've been through treatment and they've relapsed, and now they're looking for a program now, knowing that they've had a relapse. What's your encouragement for them?
Yeah, first off, I don't even necessarily, and perhaps this is me, I don't know if I even like the word relapse.
I hate the word relapse.
Yeah, because it has it has a connotation of
negative.
I've done something wrong. This isn't about being right or wrong or good or bad. And I think even the term relapse ends up being stigmatizing for our patients. It's a recurrence of a chronic disease process. And so recognize that it's a chronic illness, that hope and help and healing are available, and ask for help. Reach out and ask your medical physician, your counselor, Hazelden Betty Ford or another accredited and licensed treatment provider for the help that you need.
As that was rolling off of my tongue, I was realizing I was using the wrong word. I like to use the term recurrence of use because relapse does, I mean, that's what it is, but in terms of how people understand it, but it has a negative connotation. There's a lot of shame and stigma around that term.
I was going to say the very same thing in terms of shame. I think one of the biggest barriers for entering treatment and then successful outcomes from treatment is internalized shame. And internalized shame represents the attitudes of our society and our culture that a person struggling with a substance use disorder is somehow morally deficient, or they just don't simply want to be well, or they're not trying hard enough. And I think that's an incredibly unfair and maligning characterization of individuals suffering from this disease. And so shame is a big factor that gets in the way. And so in the language that we use, in the treatment that we offer, we want to try to do everything we can to minimize and eliminate shame so that people can access treatment and then engage in treatment and the treatment process on a long-term basis. And also help their families and their children and their support network also to do business with that shame and that stigma so that the whole family can heal and that person can have the best chance for recovery.
Well, and you just touched on something, and we need to wrap it up here, but I think it's a good way to close, which is that when somebody's considering options for treatment, they should be considering it not only for themselves or for the sick person, but for the entire family. All treatment programs should have a family or a children's program, correct?
I couldn't agree more. I think that's an important factor, right? If we do more than just give lip service to the idea that this is a family disease, then we need to treat the problem as a family problem, or as a family issue, I should say, and offer solutions as such. So I'm really proud of the work that we do with our children's program. It's really a child-centered family program that helps individuals with children 7 to 11 or 7 to 12 work through the way addiction has affected them as a family. But regardless of where you go for treatment, I would ask, or I would investigate what other types of resources exist for the family, for the children. How do you help us reconnect in our community once treatment or the primary stage of treatment has completed? What does that process look like in terms of what we call recovery management? Another thing that I think is important is to consider, are there alumni from the program that I can connect with? That's another important feature of the work that we do here. We have alumni chapters around the world. Addiction drives us into solitude and loneliness and isolation, right? So part of the solution is really rebuilding community and healthy relationship. So whether that's with my family or my children or with other sober individuals in my community, those are the important ways that people heal.
Chris Shadron, the administrator here at the Betty Ford Center in Rancho Mirage, and our vice president of the Western Region, thank you for joining us today and sharing your experience with our viewers and our listeners. We'll have you on again another time.
Thank you, William.
And thank you all for joining us for another edition of Let's Talk. I'm your host, William Moyers. We'll be back again with another edition of Let's Talk, talking about the subjects that matter to you and to us. Thank you.